A report that shows more than 100 rural hospitals across the country have stopped delivering babies or announced plans to just wind down their labor and delivery units. Now, in the last few years, according to the Center for Healthcare and Quality and Payment Reform, the risk of complications or even death for both mothers and babies in communities that do not have local maternity care services goes way up.
Here to talk about the impacts of this and what it's actually looking like here in Texas is John Henderson, President and CEO of the Texas Organization of Rural and Community Hospitals, better known as TORCH. John, thank you so much for joining us. We know it's a busy day for you and you're making time for us to bring us this insight on this new report. We so appreciate it.
You bet. It's good to be with you.
So we'll zero in on Texas here in just a moment. We want to hear what you're seeing from some of your members. But first, overall, we really just want to get some insight from you on why this may be a trend in rural maternal care nationwide. What are some of the challenges that these hospitals are facing in providing that care?
The challenges are generally around payment adequacy, and that's specific to the Medicaid program in Texas, and then workforce challenges, just recruiting OB/GYN physicians and obstetrical nurses to rural communities.
So we want to know a little bit more about Texas itself and how some of those challenges are impacting us here in the state. We'll note for our audience real quick here, according to that report that Sally mentioned, less than half of rural hospitals in Texas are actually offering that labor and delivery services at the time of the report when that came out. That's roughly the middle of the pack for states. So it wasn't one of the states with the least amount of care, but definitely didn't have the most comprehensive maternal care. So talk about Texas. What's the state of maternal care in Texas for our rural hospitals?
Like you said, the state of rural maternal care in Texas is similar to the rest of the country. But as you know, Texas is really big and we have real geographic challenges. There have actually been two more rural obstetrical closures since the report was published. So one down in Carrizo Springs, which is South Texas, and one up in Alney, which is Young County near Abilene. And generally speaking, as you go west and north in rural Texas, we're seeing more obstetrical deserts and situations where expectant moms could easily be 50 or 60 miles from a hospital that can uh, deliver their baby.
Mm. Something else the report notes is that actually it believes 20% of Texas rural hospitals may close these L&D units or were at risk of closing just last year in 2025. Is that something we could start to see more of?
We could. I will give the state legislature a little bit of credit. They did some targeted Medicaid rate enhancement for rural hospitals during the last legislative session, and we've seen a stabilizing effect of those payments. So even though 20 share characteristics with those that have already closed, we don't expect that many more obstetrical closures in rural Texas in the near term.
So what can we do you think, to keep this from continuing? Are there any solutions that are out there?
Well, I think that, like I said, the solutions lie in the hands of the legislature with the Medicaid program and funding. And then in our workforce, both physician residency programs and nurse training programs, we need to prepare students to live and work and serve in rural Texas.
John, one more question for you here. We know that a lot of our rural hospitals are just central to these communities. They're where people are going for care that may not have the kind of choice or options that folks in the bigger urban areas have. Just remind folks how important rural hospitals are and give folks a little bit of insight, especially people who may be here in the Austin area and aren't familiar with that kind of care.
For sure. Two things that are of critical importance. The first is access to care. So when you and your family member are in a rural community or traveling through a rural community, and have an accident or a heart attack or stroke, access to care is critically important. But the second thing that maybe is a little less apparent that we try to remind people of is that rural hospitals are foundational to local economic development efforts. They're most of the time either the largest or second largest employer in the community. So it's about access to care and jobs. And for those reasons, rural community hospitals in Texas are just essential.
John, thank you so much for this insight. There's a lot more to that report. We could probably keep you here all day, but we so appreciate you giving us some insight into this ecosystem and what folks should be on the lookout for, particularly our families who are seeking this kind of quality care. So we appreciate it so much.
You're welcome. Thank you for having me.